Okay, we are recording. Hello, everyone. Cat class today. I'm really excited about this. This was our very first lecture, and this one will be better. So if you missed that one, I don't know if there's. I'd love to hear about it in the chat. If there's anybody that that didn't have to be here, that was actually here for the first hyperthyroid talk, that would be great. And it's been a while too, so I think it'd be kind of fun if, and maybe we'll add this in a couple minutes to the chat too, if people want to let us know where they're visiting us from and listening to, because that'd be fun to know again as times have changed. So today is going to be hyperthyroid. And I usually start with a picture. This is one of my favorite pictures. This is up in the North Cascades National Park when we were walking down from, I don't know, 8,000 feet, 7,500 feet down to pretty much sea level, but it was getting dark. So it was just a vivid memory of a long walk with just headlamp. And I remember trying to tell myself to figure out the difference between if you're just seeing eyes shining back at you, if it was a deer or a cougar. And I figured out the deer run away from you, but the cougars don't. So, so also when we do these lectures, we usually do an encourage, a challenge. There's part of it that's going to be hopefully encouraging. We like to challenge you too to think a little bit differently than you might learn just from your textbooks and your classes. And I like to elevate somebody as well. And so today I'm going to bring up a friend of mine that is a wonderful artist. She's not a veterinarian, but she is a really, really big advocate of our profession, and she's worked in veterinary clinics, and she's trying to become more of a, I think, professional cinematographer as it is, but she does great work. And so I'm going to share a little video of hers, and I think it does fit in with hyperthyroidism a little bit when you see the cat that's in hers. And we'll see if I can get that up and going. It's just a 2-minute video. And let me know if you can't hear the sound.
I think it's natural for people to take time for granted. But so much of their time is spent wishing time away so that they can get to the good parts. The smaller, seemingly insignificant moments are then often overlooked. But it's the small moments with you that I treasure. Snuggled up in your arms, rising and falling with each of your breaths, feeling the bass of your voice through your chest. You could call this our routine, but I know these routines, it's what makes it so easy to forget how much time really means. Inevitably, with time comes change. And things have changed for me quite a bit. I don't get around as well as I used to. I'm probably on enough meds to stock a small pharmacy. And not so long ago, we found out that parts of me are, well, shutting down. But we've had a wonderful life together, you and me. 20 years is much more than many. But we both know our time together now is limited. And I wish my time with you was much, much longer. Those just aren't the cards I've been dealt. And that's okay. I'd take even 1 year with you than all that I've had without. If you have to take away anything from our time together, I hope you remember this. Stop. Stop wishing time away. Stop and take in those smaller moments. Life and the ones we love are precious. Time is precious.
Okay, let me stop.
I'm just crying over here. It's
Yeah,
cool.
I know.
Thanks for the warning on that one.
Yeah.
I'm like, there's just something in my eye. It's fine.
Sorry, you guys, but that gets me every time too. And I've already watched it twice today. But I don't know if Mariah's on here, but I think she's big into storytelling, and you can tell by just a couple minutes of some pretty amazing video. You can tell some pretty incredible stories, and so it's great to have her on our team for the profession. And I'd love it if let's go back to there. If everybody can go and just find her and follow her, and it'd be cool if you you don't want to leave class, but if you've got another device, and we had 50 of us doing that all at once, I think that'd be a good shout out to her. And even if you just share an encouraging message, that'd be cool. But she's a really, really, really nice person. She's a friend of mine. A sticker on my water bottle from her, and if you get to know her, that'd be great. And that brings up just a little bit of a topic too, of just this profession in general. That I only met her because I saw some posts on Instagram and reached out and told her I thought what she was doing was really cool, and I was friendly, and she communicated, she responded, and we've become friends since then. And please don't just be a spectator in this profession. The joy and the power of this profession is the people. And for most of my career, that was just who was around me in my community, and who I could reach out to on the phone. And it was pretty small, and now it's huge. So you're not limited to just who's inside your building to reach out to. And yeah, some people are going to think that's weird, and they're not going to respond. They're not going to appreciate that, but that's okay. There's going to be a lot that do. So please reach out and get involved with the community. Okay. So hyperthyroidism. We did this before, but it's one of my, like I said before, it is my favorite disease, I think, because it's a disease where we can see our older patients and we can give them a lot better life. And it is also a disease that communication is super, super important, because a lot of the symptoms that we think of as classic hyperthyroid symptoms, we've got an old cat, they're eating well, yeah, but they're losing weight. But they're pretty active. And so a lot of times, some of these symptoms are looked at as, hey, my old cat's doing great. So we have to take some of these things where your cat's wanting food all the time, and people like to love their animals by feeding them and telling them that this probably isn't normal and this could be leading to some other problems. And so it's really, really important to think about that for your clients, because they may not, when you see them for annual exams, they may not see these as possible problems. But the typical classic, I've got them bolded here, of the symptoms. Geriatric cat, I've had some that are hyperthyroid at 7 or 8, but that's super, super rare. The vast majority of them are going to be over 10, maybe even over 14. But they are geriatric cats typically. So those are the 3 primary ones. Usually they're yowling a lot, and that might be what brings them in, because they're keeping people awake at night. That could be due to hypertension. It could be due to cognitive dysfunction. But I think hyperthyroidism may be a comorbidity along with those other problems, or it might be part of the underlying whole reason why they're yowling. They're usually a lot more active as an older cat. And then two, just because their metabolism is so high, they might be seeking food, seeking attention for food or whatever more. And one thing you don't think of too commonly, but they can be extra thirsty too, whether that's thyroid disease, whether that's a comorbidity, or a little both, who knows. Sometimes we'll see vomiting just because of hyperthyroidism. Sometimes we'll see diarrhea. Sometimes we'll see coat changes or just other issues that are coming up, behavior type things that are changing. So whenever somebody has changes that come up in an older cat, it's always worth trying to get a diagnosis on this. You guys gonna let me know if there's any questions coming up? Because I can't see the chat right now. Okay.
Yeah, we'll get you.
Okay, thanks. Anybody else have any comments on symptoms before we move on? Okay. So, diagnosis. One reason I like this too is it's a little bit more straightforward to diagnose than some other diseases. Of course, we always want to take a history, and that can get us really definitely pointing in the right direction. I think it won't take too long for you as if you're seeing very many cats in your practice, it won't take you very long while you're going to be betting the techs before you see the blood work come back if they're hyperthyroid or not, because you'll really get a knack for this pretty quickly. Physical exam. And a lot of this on physical exam, there's not a particular, I think this cat is hyperthyroid because just looking at him, because they could have all sorts of other senior diseases then look that way, kidney degeneration, arthritis, other stuff. So tying that with the history and tying it with baseline data that you have from before as far as weight, heart rate, body condition score, muscle condition score, those all fit in really, really well. One thing that it is good to work at a lot, and even in young cats, old cats, whoever comes through, is work hard at palpating those thyroid glands and seeing changes from one side to the other, from mobility, from obviously just size too. And that's a skill. That's still very difficult for me in subtle cases and to tell like the difference. But my associate, Dr. Wilford, she'll pretty much say, well, I think the T4 is 6.7 because the way she feels the thyroids. I think she's making it up, but she's pretty good at diagnostics. So when we've done, this is one where you definitely can't go on a hunch. You need to know where their levels are, and if they're normal or abnormal, to point in that direction. And so the hallmark for that is T4. And I don't use T3, TSH, those types of things to make my diagnostic or to follow up with. And maybe some other people have some better or a better feel for free T4 as well. But I don't use that too much either. And I think the reason is because I don't really follow the normal ranges for T4 for these guys. As you can see in this slide, this is from IDEX, and they're calling their normal range up to 4.7. And if maybe a 2-year-old or a kitten that's really got a high metabolic rate when they're growing, somewhere up in the 4s is normal. We're not checking T4s on kittens, but if it's getting above 3, I'm like, if there's any other extenuating circumstances to tell me this is hyperthyroid, I'm gonna treat it as a hyperthyroid cat. Whereas I think in school, in textbooks and that kind of stuff, if it's under that normal range, they say you need to get some backup data, a free T4. And in my experience, it just, I just don't see those that it really helps me that much, that it just discerns it that much better. Any of you guys use free T4s a lot?
I definitely don't ever do free T4 or TSH on a cat. If it's high, it's high, and there's usually symptoms, so I usually treat them based on that.
I can't
I
see you, but I
agree.
bet that's
I rarely
Jackie.
do. It was Jackie.
I was gonna go speak.
Yeah, I agree with that. I don't run free T4s in these cases, and if it is like equivocal or middle ground, and we're not really sure one way or the other, which doesn't happen often, I usually just recheck the T4 in 30 days or something, and usually it's pretty clear the trend that's developed.
Yeah, I agree. I mean, I'll run the free T4 plus TSH add-on panel at IDEX with dogs all the time. I don't know that I've ever actually run that for a cat in 5 years.
I've got a cat now that's kicking my butt that has IBD. It's had some really bizarre subcutaneous, it looks like necrotizing fat, but we removed them. There were swellings. They came back as mast cell tumors. It was just the weirdest looking stuff that I've ever had. And I just, as this guy's been aging, I just have been sure that it's been hyperthyroid, and because we were following up on other stuff, and then finally it came back as 5.6, so definitely hyperthyroid. And I've been following up on it though, and it's like the symptoms are still there. It's not gaining weight, still has a little bit of GI symptoms, it's eating well, but we follow up and it's on like a quarter of a 2.5 milligram falimazole, and it is registering at less than 0.7, but it's still acting hyperthyroid. And who's drawing on my screen? You guys?
Not me.
Not us.
Not us? Okay, now it's gone. I don't know who could. Somebody was drawing stuff on the screen. Maybe they're taking notes to themselves. That's cool. I didn't know I could see that. So this one, it's there are some that I think their baseline is definitely lower. Like you could have a cat, if you were checking them all their life, and it was always 1.1 up until it was 12 years old, and then it was 2.1. That could be a hyperthyroid cat if all the other things we're starting to get an elevated ALT, we're starting to get an elevated heart rate, weight's going down, appetite's going up, and so those are troublesome ones. But for me, this is kind of where I go. If I've got it's sneaking up and it's in that gray zone and everything else fits, I'm going to say let's figure out how we can treat this and see what Joey does or she does.
So Saskia had a follow-up question to our conversation about do we run a free T4, and just said, can you explain why total T4 is better than free T4? I would think, just to clarify, the free T4 is probably more accurate, right, in terms of active metabolite and what's happening in the body, but it's more expensive. And usually the total T4 is included in what we're able to run in like in-house labs and what's on most senior panels. You have to add it as a specialized test to run free T4. So I think the conversation the doctors were just having is more along the lines of it's clinically sufficient to just have the total T4 number and not get the additional expense and send out for that additional test to get the free T4. So you're right, it's probably more clinically accurate to have a free T4, but it's not necessary for diagnosis, was kind of the conversation we're having.
Yeah, I concur. I just typed it into the chat. I was like, it's not better. I just don't think you need it. I think that typically totally T4 in a cat is going to be enough to get you where you need to go. Whereas like, I know we're not supposed to say the D word, but for dogs, a lot of the times you're not 100% sure about the hypothyroid aspect. And so that free T4 with the TSH so the free T4 being low and the TSH being elevated, then that's that kind of push that you need to start treatment. Versus with hyperthyroid cats, I think that total T4 along with clinical signs is plenty in the majority of cases.
Yeah, it's if you're puzzled, I think it's not bad to reinforce your concerns, your thoughts, your theories with alternative diagnostics, because sometimes they help. But I see some where, and I don't know if it still is, but with our lab previously, it was like an additional $100 to the client to just add a free T4 on. And I have some that are doing that, you know, it's great for production, I guess, that are doing that on every older cat, just adding that in. And I don't think that's a good way to go initially right off the bat. Okay, so this to me equals hyperthyroid. And I don't know that we need to go into why ALT is elevated, but it is. And we could talk about that longer, but if you see a hyperthyroid cat, if you're concerned about hyperthyroidism and the ALT is elevated, and sometimes if it's really hyperthyroid, you'll see all the liver enzymes being elevated, don't panic as you follow up, and we'll go into that later, but as you follow up, it'll come down if it's related to the thyroid disease. Okay, anything else about diagnostics before we go into treatment?
There was a couple of questions about potential, like linking, like when should you be screening these cats for potential cardiac involvement in these cases? Like, would you just recommend workup if you hear a murmur or you hear a gallop, versus are you talking to potential heart disease for everyone?
Oh, yeah. Yeah, because first off, you could definitely have some heart disease without having any abnormal heart sounds, except they're going to have a really high heart rate. So if they're hyperthyroid, I kind of link it. If they're having a murmur and talking about the risks of cardiac disease as a hyperthyroid cat, and kind of see where that goes as far as on the workup part of it. I will say that most of my clients, when we're kind of shocking their world about a lifetime treatment or expensive procedures or whatever disease, are going to say, let's see how it does first before we get a cardiologist and all that kind of stuff involved. It's definitely good to talk about it and to document it. And then if their heart rate comes down to 180 and there's no symptoms, they could still develop some cardiac muscle disease or had it. But following up with their hyperthyroidism is going to be good. Certainly gold standard is, gosh, if you could do an echo on every cat as you manage their hyperthyroidism, that'd be cool and that'd be awesome. Because if they live long enough, they're going to get heart disease. But as far as a initial workup in my clinic, we're not usually getting the cardiologist involved until we see how they're acting after we manage their thyroid disease. Getting their T4 down is going to be the best treatment for any of these guys.
Just a quick little note.
Yeah.
I don't know if I'm the only one who does this, but if there's owners that are concerned, and definitely the ones who want to be the most aggressive, I'll offer echo, and that's never wrong. But there are some owners who are worried about it, but they might not want to jump to echo quite right away. I'll offer a pro-BNP to those clients, or thoracic radiograph. So I will offer pro-BNP on all of my senior geriatric cat panels, but especially for these guys. And pro-BNP, oh, somebody just popped up pro-BNP in the chat. So yeah, so pro-BNP is a biomarker, that might indicate abnormal cardiac muscle stretch. And so it's not an end all be all. And I tell people, just because the pro-BNP is normal doesn't mean that your patient does not have a cardiac problem. But if it's elevated, that might push us more to look into further testing. So that's a good option too. And I know at least at IDEX, if you add on a pro-BNP to a general panel, it's like a fourth of the cost.
Yeah.
So $50 instead of $200, which is really nice.
I would also say don't forget about x-rays, right? Like they're not as specific and good as an echo. Like you aren't going to be able to see if there's clot formation in the chamber. Like you're not going to be able to see, is the, cardiomegaly truly because of HCM versus something else. But, as a baseline, if someone can't go get an echo, but you're concerned about potential for, heart disease, getting a baseline x-ray may be a compromise that they can go for. But I kind of agree with Gary that I typically don't jump into a cardiac workup unless there's a murmur or they're having other symptoms similar. And I try to remind clients, one of the ways that I present it to clients is that the heart's a muscle just like your bicep is, right? Like any other muscle in your body. And the harder it has to work, the bigger that muscle is going to get, right? So if you sit and you do bicep curls all day, every day, your bicep's going to get bigger. Well, the heart's been beating against high blood pressure. It's been beating rapidly. The muscle's been working out a lot more. And so it's gotten bigger. So if we can regulate the thyroid and the heart's beating slower, the blood pressure is better, you know, there's some of that will be potentially reversible. And I've had some cats where the murmur goes away at the recheck visit, or, you know, because they're less tachycardic, you know, some of the things that they used to be exhibiting that might make you concerned about heart disease have gone away. So I'm kind of in Gary's camp with you kind of waiting to the recheck sometimes to evaluate some of those pets unless there's something really concerning at the primary visit.
Yeah, that's that was a great great addition, the ProBNP talk. I've also been doing a lot more of just the SNAP ProBNP tests in clinic. That they're an IDEX deal too, and it just tells you normal or abnormal, and it's a lot cheaper. I think I can do that out the door to the clients for, I think it's like $60 or something. So so that often helps us tip the balance. I don't know who, can anybody else see these arrows? No, they're I don't know who's doing that, but please stop.
Someone's hacking you.
Yeah, I'm getting hacked with arrows. So that can sometimes be a help for a diagnostic. Is the heart muscle at this point, can we say that it's normal or abnormal, and that focuses your attention and your concern on cardiac disease maybe a little bit more. Okay, surgery. I don't know about you guys, but I haven't done this surgery in probably 25 years, and I would even classify it sort of here in, at least in the Seattle area in Western Washington. I would, maybe somebody can talk me out of it, but I'd say it's definitely not standard of care. And could it possibly be malpractice? I don't know. But as far as risk, expense, you know, putting something through anesthesia, reversible, possible complications, any of the other options I think are cheaper and less risky than surgery. So I don't think removal is a good option in areas where you have radioactive iodine treatment as a possibility. Diet. I love this as a first option. So I don't know if everybody's familiar, been lectured about prescription diet YD, but this is a ultra low iodine food. I don't know what they do to pull the iodine out of the ingredients that they put in there. It took them, I think, 8 years of development to come up with this food. It's not a huge moneymaker for the company, so I doubt that they're going to come up with different flavors or different textures or that kind of stuff. So that's the one problem, because if they don't like it, it's off the table. They need to like it, and they need to like it for a long time. It does come in a dry as well. Obviously, for these older cats, I would prefer them eating canned, but it's an option, and it's something where you need to counsel people that this is all they get forever and ever, and they don't get any treats, any snacks, any table food, and so it's a different conversation if they're an outdoor cat, if it's a multi-cat household, if it's just not going to be possible to feed this food. You can feed it to other cats, but it's super expensive. So if you had 5 cats on YD, you're going to be spending a lot of money, but it usually, I haven't seen one where it's going to make a cat hypothyroid. It's limited, but not specifically deficient in iodine. And with my experience with this would be something that if the cat's doing well, I still like to follow up with them and see how their heart rate is, see how their weight is, see how they're doing. but I may not run lab work as quickly after diagnosis and starting on this food as I would on medication, because I think they feel better and I think they do better, but for some reason it takes on some cats quite a long time to get to as low as they're going to get. So I'll even go out if they're happy with how they're doing, they're eating the food, they seem calmer, they're doing okay. I'll even go out 2 months to recheck blood work, just only to save money. I love getting more data points, but lately I've been seeing them not as low as I think they're going to get, and so then I got to talk the owners into more money. And one of the reasons they may have been excited about doing YD in the first place is because of the paranoia about overdosing on medication, and so you don't have to follow up as much. And you usually know by then if it's going to be something that the cat's going to be excited about and eat about and maintain their weight on. One other curiosity with this one, and we'll talk about the flip side of this when we get to medication and follow-up, but is that I typically see BUN and creatinine improving or stabilizing when they're on this food versus other treatment options. And I don't think anybody knows why that is. We don't know if it's on the enzyme level where it just somehow they just don't make as much of the enzymes, or if it's truly more renal sparing than some of the other options. But they look better. Don't know if the kidneys are functioning better, but they look better on paper. So that's another thing to think about with diet.
Here's a couple of questions really quick.
Okay.
One of the questions, I was going to say that when I talked to the nutritionist at Hills, that they told me, I think this is when I was still working for you in Seattle, but I don't know if you remember when I called Hills and I talked to them, and they said that like 90-something percent of cats are going to be where they're going to be on the diet at about 8 weeks, but there are some cats that might take up to 12. So they definitely said if you're seeing some improvement, or not as much as what you would want, and you want to give them the benefit of the doubt, you may need to go up to 3 months. So that was what they had told me originally. And then we did have a question that says, would you only consider YD in cats that have uncomplicated hyperthyroidism, like no hypertension, no cardiomyopathy, things like that? So that's the question that I have for you.
No, I wouldn't unless they were allergic to chicken, and we knew they had a food allergy, or it was imperative that they get their thyroid lower faster, and then I'd be probably, and it's riskier, but probably going towards radioactive iodine. But for the particular issues with hypertension and cardiomyopathy, I don't think that there's any reason that this wouldn't be a great first line attempt at controlling those as well. I used to want to wait to treat hypertensive cats until I got their thyroid normal. I don't worry about that quite so much anymore. So if we're going to be either starting the food and they don't have a medication to go home, then putting them on a blood pressure medication at the same time. I'm doing that a lot more now, and then just obviously following up with that, and maybe we don't need as much later, but I don't like hypertension, so I want to treat that high blood pressure as well and as quickly as I can. Okay.
What about
oh yeah,
your cats with CKD? Do you prefer to have them on the thyroid diet and then treat and maintain the kidney disease in a different way, or would you prefer to have them on the kidney diet and treat the thyroid differently?
Yeah.
I feel like this is going to be a classic depends question, right?
Yes. Yes. That's a good depends question. I would not, for kidney disease cats, I would not hesitate to put them on YD. If they're eating well and we can treat them with diet, I don't hesitate at all to go with YD first to manage the thyroid disease. and then seeing what's going on with the kidneys and their appetite and their weight, and adjust after that.
Yeah, I would agree. I think you have a much less chance of causing kind of the overdose concern, right? Of you regulate them too quickly, the kidneys get worse, and you might need other oral meds with your kidney disease, whether that's for hypertension or protein loss or other stuff. And so this is one place we can remove a tablet and hopefully have it help.
Yeah.
So,
and it's a super easy, let's just try this and see if they like it. And you can it's either still an option or it's not an option within a day. Because if they're not going to eat it when they're super hyperthyroid, they're never going to eat it because they're so hungry at that point. So people are being indecisive. Send a couple cans home and let them digest things as far as the diagnosis, think about stuff, and get back to them the next day, and decide, where you're going to go for your initial therapy for them for a little while. But it's easy to send a little bit of this home. Okay, medication. There used to be some other medications, but now it's pretty much just methimazole. And of course, the cat-specific falimazole. Falimazole comes in 2.5 milligram and 5 milligram little tiny coated, and they're different colored tablets. And this is kind of the hallmark of our therapy to decrease their production of thyroid hormone. And there's also, this is one treatment or one disease where we will consider transdermal medication. And the reason I consider it as an option, so we're getting it compounded with methimazole into a gel, cream, lotion, whatever you want to call it. It's technically a gel, but people say, you didn't send me home with any gel, I just have the cream. So it looks creamy, but you can give them something and then measure it. So we don't know how much they're going to absorb. If you followed up with them and they were on a certain level of methimazole, changing over to the exact same milligrams of transdermal, I have no idea if it's going to be more potent because it's bypassing the GI tract and it's going straight into the bloodstream, or a lot less potent because for that cat, it's not absorbing through the skin as well. You just never know, but you can measure it. So if for whatever reason they want to change, it's like, okay, we're going to start all over again, start conservatively, recheck blood work, and go from there on that. So for people that cannot pill, this is one disease where transdermal is on the table. Any chat stuff before I go to dosing and things?
I don't think so. There's been a few questions about medications for other concurrent processes that I'm kind of trying to field for now, so we can actually get through all the thyroid treatment stuff.
Yeah,
it's about blood pressure meds and stuff like that. So I'm just kind of putting little tidbits in there for you.
Cool. We'll get some of that going on the follow-up too, if you're not covering them all then. So this is where I would feel that you need to advocate for your cats and not try to do shortcuts. I will tell you, it's super critical for the long term of your patient to start slow and be conservative when you medicate them with methimazole, because the hyperthyroid cat is bad. A cat that has had their kidney function traumatized by making their thyroid hormone and their perfusion and everything too low with methimazole is bad news. And we don't know what the kidney function in these cats is while they're hyperthyroid, right? I mean, part of the diagnostics, we were really brief here, obviously, on just checking a T4. But part of that diagnostic process would also be, we'd want to know what the rest of the lab work is like, right? Kidney values, electrolytes, urine-specific gravity. And we talked about these in our other lectures as far as SDMA and how we try to determine kidney function in our patients with concurrent diseases. But this is one where I really, really, really like to have a urine-specific gravity in the initial diagnostics, because that's going to be harder to fool in a hyperthyroid cat than creatinine and BUN. And in older cats with other diseases, for me, SDMA is kind of all over the board. So I don't trust that or look at that as the be all and end all for kidney degeneration in an older cat if it's normal or elevated. And so knowing a USG when we start helps me know kind of where we're going, and following up with that afterwards to say things are getting worse or things are stable there helps me, because you're going to see cats where their creatinine goes up as you manage them with thyroid disease, and it's going to be a balancing act. Do we want to let them be a little bit more hyperthyroid and spare their kidneys, or do we do a lot more medication, sub-Q fluids, change diets, other protectants for their kidneys, as well as treat their thyroid disease? And that's a tricky combination. So I always start these guys off low. If it's a tiny little 6-pound cat, I might even take those 2.5 milligram folimazole tablets and try to get them into quarters and go from there. But most cats, I'm taking a 5 milligram tablet, doing a quarter of that twice a day. And then some of these guys, if I'm worried about them, like, I don't know about this cat's kidney function, and I'm worried about what this is gonna do, I'll check them in a week. I'll definitely want to get them in and urge them to come back within 2 weeks for my initial ones. I think 3 weeks to a month is kind of standard in what people are taught out there. And a lot of times that goes absolutely great. But when you have some that you're overdosing and you don't know it and you have no idea, you could have a cat that starts at their thyroid hormone level, their T4 at 20, and you overdose them at 1.25 milligrams or a quarter of one of these tablets. You could have cats that are 4 and they need 10 milligrams twice a day. You just never know. So I always start conservatively, and I tell people ahead of time when we start using this medication that it might take, we might have to do 6 blood draws every 2 weeks to get to the right point, or we might get it after the first try, and just so they know ahead of time. Okay, I'm talking a lot. Radioactive iodine.
I feel like that was a really important point that you just made, so I'm just going to highlight it.
Cool.
Agreed. I second that.
When you're picking your dose for your cat, base it off the cat's weight, not how high the T4 is. So I get that question a lot from my friends and stuff. They're like, oh man, I have this cat that's like up at 20. I'm really afraid they're going to thyroid storm or whatever. And so they'll be like, we're going to start at 2.5 twice a day. Or I've even had people be like, they need 5 twice a day. Like clearly it's not going to be, controlled. And some of those cats, I would say a lot of those cats crash because often those cats that are up that high have been chronically undiagnosed for a long time, are at higher risk of kidney disease, and have less body mass to metabolize the drug with. And so look at your cat, look at your cat's weight, and decide, start small with the weight of the cat, not with how high the T4 is. And I tell my clients, it's one of the few times that I actually instituted almost like a rule. Like most of the times I try to have a conversation with my clients about stuff. This is the one time for me where I'm pretty much like, this is what we do, full stop. You're coming back in 2 weeks and we're going to check this, because those cats, it really matters for the cat that the dose is inappropriate for. And I've definitely had my own patients that had totally gorgeous looking kidneys on their first blood work. We started them off on 2.5 milligrams twice a day, like it says in Plums. And when they came back at 3 weeks, they basically on paper looked like a stage 4 kidney cat, and that cat died 3 months after we started meds. So I learned from experience, and you can learn from my experience too, and from the experience of other vets like myself, that this is another situation where I don't trust Plums and I start smaller. And I really, really tell people, and very strong, straightforward way. Blood work has to be done and done soon so that we know if this is safe.
Yeah.
So there's a couple questions about dosing and rechecking, if you guys want to hit those. There was a quick question about thyroid storm. A couple people haven't heard that term, and I apologize. We've thrown that out there a couple times and haven't covered it too much. And I think the reason is because we don't see those super often. A thyroid storm is just kind of a term that gets used where they basically go into a progressive and severe form of hyperthyroidism where they are very, very clinically affected because the clinical signs are severe. So these cats can get arrhythmias. Their thyroids are usually really high. They're extremely hypertensive. The ones that I've seen have been so hypertensive that they've been acutely blind. They require hospitalization and therapy and usually intervention from a very smart criticalist and cardiologist. Those cases are fewer and further between, but those are that's just kind of a brief overview, and I'm happy to talk more about that another time. So, but there's a couple of questions about what are your thoughts on once a day dosing, and what's the target T4 that you typically shoot for?
Yeah.
And then also once they are well regulated, how often are you rechecking? Which are really good questions.
Yeah. Let me do radioactive iodine, and then we go into follow up, and so that'll be kind of that. And radioactive iodine will be quick. I don't have a license to do radioactive iodine. You have to, in most states and regions, you have to have a special license. You have to have special facilities, and that's a lot of the reason why it's so freaking expensive to get it done. And I've heard some places it's $1,000 for the treatment to get done. Other places it could be several $1,000s, depending on the community and supply and demand and what they can get away with and how the regulatory costs for them doing it. What I like to tell clients, though, is that this is permanent as opposed to medication where we can titrate it. It's nice because you don't have to hopefully you don't have to give them any medication after this, and that's the goal. And it treats it more consistently, whereas the medication, their thyroid level could still be going in a little bit of a wave up and down a little bit throughout the day or throughout the week. Radioactive iodine, it takes care of the problem. I've had some cats that will develop another independent case of hyperthyroidism after radioactive iodine. So it's not, you got to tell people it's not 100% permanent, but usually that's typically a good 5 years after, if they're going to get it at all. I've seen some maybe at 3 years, but most of them, if they're going to get it again, it's 5 years. And there's nothing special like magic cookie cutter about radioactive iodine. It's people making decisions how much to give and all that kind of stuff. And just like thyroid medication, every cat's going to be a little bit different, and they have their protocols and how to do it. But get to know, if you have a radioactive iodine center around your place, if you have several, get to know them, figure out how they do it, what their safeguards are, and all that kind of stuff. And you need to let your clients know that you may have different criteria than the radioactive iodine people, because they're going to say, go back to your, do a 1 month follow-up. It's like, no, you're going to do a 2-week follow-up, because we want to make sure that the kidneys are still okay after this. So let the clients know ahead of time. We have a radioactive iodine treatment center here that sends every patient home with a handout on that they should feed raw food after that. Wow, I don't even know why. I don't know where they come from. They say that they don't want to, and they also a handout that you have to sign that says you're not going to come back to their clinic for any other regular care for their cat. So you need to let people know when they get out of your care that somebody else has access to them and is going to put stuff in their head, and it's not just Google. So prep your clients before you send them to another facility for anything, what your expectations are and how you're going to take care of them, and that they might hear other things. Okay, so done with that soapbox. I know we're getting late. So follow-up. Yeah, so typical follow-up, we've talked already a lot about this. We want to know the T4 within a couple of weeks. Again, my renal function, we're going to get lab work. We're going to get a panel that has creatinine, BUN, liver values, other stuff on it, but I really want to get a urine specific gravity and follow that as I'm managing these cases, just to get more data on that. So what happened to the ALT? If it's coming down, I don't worry. I don't worry about talking to them about liver disease, triaditis, all that kind of stuff. If it's going up, then we have to decide, is it because of methimazole? Is it because there is a comorbidity? And then you can start looking into it and talking to them about, do we need to do an ultrasound? Do we have cancer or something going on in there? But I don't worry about that until after I see their T4s coming down. Obviously, the weight should be going up. If everything else is good, but their weight's going down, we've got either a appetite problem, we've got a comorbidity going on, an absorption problem, that kind of stuff. So if it's going up, everything's great. We're following up with that, getting those data points. If it's not, we start looking for other stuff. And what are the owner impressions? Again, like I talked at the very beginning, some think that their cat's great because it's acting like a kitten. It's following them around and yowling at them and wanting food. And so is the cat too depressed? Are the owners happy? And then it's just a good opportunity to educate. Okay, can we explain these as normal? This is now a normal old cat, or are there some things that have changed that maybe say, okay, maybe we have upset stomach from the medication. Maybe there's something else going on. Maybe we've got some kidney disease ramping up that we need to follow up more quickly with. So always taking that history is important. Appetite. They should still like their food, but not as ravenous. And that's something that I tell all clients ahead of time, whether it's we're putting them on YD and they're just chowing down on it initially. And then as the food starts to work, they're not as hungry. So they say, I don't think he likes the food anymore. And I say, hang on, keep doing what you're doing. Let's get the cat in. And if the cat's weight is up a half a pound, but they're eating half as much, then it's like, they're doing fine. They're just not as ravenous. And so you need another data point. So that's something good to let them know ahead of time, is that if we're doing everything right, your cat's going to eat less and gain weight. And that's another point I have when I'm telling about how expensive YD is and these other things, is like, if it works really well, you won't have to feed them quite as much as time goes by, and you get away with spending less money on food. And then all those other factors, vomiting, you can have if there's comorbidities and your T4 is elevated, I always like to get the thyroid under control before I start going down rabbit trails with comorbidities, because I've had cats that have crappy skin, they're itchy, they're throwing up every day, they have diarrhea. We get their thyroid under control, and most everything else just goes away and normalizes. Maybe not orthopedic issues, but that's something good to fall back on, and not think, oh, we've got thyroid under control, we don't have to worry about anything else. So finding out, still taking a history and all that kind of stuff, not just having them come in for a T4 recheck. I think it's really, really important to follow up with these cats, because there's a lot of moving parts on an older cat that you're adjusting. Okay, we've gone long as usual. What were the other questions that we didn't? Oh, following up on intervals and dose levels of T4. That's a good question. So T4, again, if it's in the normal range, that doesn't necessarily mean it's where we want it to be and desirable. So I'm usually trying to get them down, I think about 2 on their T4. Now, I don't know other countries if there's different values, different levels. But if they were 3 or 6, I still like to see them around 2 and see how they're doing. Some cats might be better at 1, 1.5. And if they're at 1 or 1.5 and their creatinine's 1, I don't worry so much. But if their creatinine was 1 and now it's 2.5, when we get down to that level, I'm going to titrate up so their thyroid level isn't quite as low. Obviously getting their heart rate, their weight, and all that at the same time. The big answer is it depends on what you're aiming for. But I usually think, 1.8, 2.2 is kind of a sweet spot for these guys. But every cat is a little bit different, what their level they're going to do the best with. Let's see, any other questions?
There
Did I
was one
miss?
more question about what you think about once a day dosing.
Oh, yeah.
I think most of my cats do better on twice a day. I think that that's pretty standard, but I've had plenty of cases where I felt like they weren't super hyperthyroid and twice a day was just too much, and we were able to kind of maintain them at a smaller dose once a day. So I hate to say it, but it depends, at least in my mind. I have had a few cases that are okay at once a day, but I think most of them need it twice a day.
Yeah. Yeah, I think that's going to be the exception to the rule. There are some smart people out there that are internal medicine specialists that say that once you've got them maintained, you should be able to keep it that way, that they're not going to be producing as much T4 and stuff, so you can keep them at once a day. It's hard to tell, right? Because unless we're doing like a thyroid curve throughout the day, I do think that it fluctuates, and it's going to fluctuate more, highs and lows if it's on twice a day. But manage your cases, because some people are going to say, sorry, this cat's only getting it once a day. That's all I can do. What's the best we can do with that? And go from there. But typically, yes, twice a day.
Yeah,
Okay.
and if I have to do a split dose, or if you end up doing once a day, I typically like to dose at night as opposed to during the day. And the reason being, when we think about the symptoms that these cats typically have, one of them is that they get hyperactive and they are very vocal. And we're not exactly sure why that is all the time, but there's some thought around it being, a symptom of the hyperthyroidism or potential the feeling of like you're on caffeine all the time. So those cats do better at night if you dose them at night, and then the owner's not getting woken up in the middle of the night by a yowling cat and the cat asking for food and all of those things. So if you're going to do it once a day, or you have a split dose where you're giving like a half tablet at one point and a full tablet at another point, I typically do the bigger dose at night.
Good point.
Yeah, I agree with that. There is one more question about, well, actually two, but they said how long to push out thyroid rechecks once you get to a well-regulated cat. I'm an every 6 monther unless the cat's not feeling well or the owner's worried that something changes. I think that's pretty par for the course. Sometimes people are like, I'm coming in once a year unless my cat's not feeling well, and that you can only make recommendations, but I'm definitely an every 6 monther.
Yeah, I think this is one that you definitely 6 months, but I think this is one that you could justify even every 4 months, because these cats are usually super old and there's things going on, and I do get worried about if that's going to dip a little bit. Yeah, and that brings up one quick follow-up question. Comorbidities, we've talked about this so much, that if you have a hyperthyroid cat that then gets a UTI or gets teeth that need to be extracted or whatever else, we just like you have learned about, kind of euthyroid sick, where if cats might not show that they're hyperthyroid when other things are going on and their T4 looks normal until you get the other stuff taken care of. That happens with us when we're sick. Our metabolism goes down, or T4 goes down, or whatever other parameter you're measuring. And so if these guys are sick for other reasons and it's something that's come up since you've regulated them, during that time you might be overdosing them with your methimazole. And so that's another reason that it might be good to get these guys in sooner, or at least touch base with them. How's things going? If the owners can weigh them at home and all that kind of stuff. Because that's something that is a concern for me if new things come up. And these are old cats, so new things come up. So that's it. This picture, that's Mel out there on the Washington coast. Picture.
Yeah,
We left her stranded
camping
on that
last summer.
Yeah. And we're still planning on having our camping trip. We've got some theory that we need to
sneak peek for Friday real quick, Gary.
Oh, yeah. Yes, I meant to talk about the schedule for next week earlier today. So, Katie, tell us about. Oh, there we go. Perfect.
Showing up right? I can't even. Crazy. Sorry. So on Friday, we're going to have a little surgery bonus. I know in discussions last week, folks seemed interested in this idea. So I've got a cute little kitten video, and I'm not going to promise that it's high quality videography, but we're going to break it down and go through step by step and take questions on different approaches to different parts of the surgery that you all might have. If we end up having time, I also have a cat neuter and a cryptorchid video. And if we don't end up having time, that'll just be for another day.
Cool. So is this, can we say we're kind of venturing into wet labs here with this?
Sure. Virtual wet labs.
Yeah.
Sure.
I'm excited for Friday. I've seen the video, and Katie is a fantastic educator, and she knows anatomy really well, way better than I do when she's talking about all the stuff that's going on inside there.
Same. Agreed. If you are not feeling super comfy with surgerizing and you want like any extra info you can get, I would very strongly encourage you to watch this lecture because Katie is phenomenal. Like I could watch her all day. So get in there.
Yeah. And for those of you who are still on the call, just next week, a little secret that we haven't announced yet is that Tuesday, we're doing a special bonus edition on Tuesday, same time, but we're going to have Dave Nickel kind of giving a pep talk on getting out there in your first job and pep talk about anything in life. He's fantastic. He was the VMX Speaker of the Year this year, and he's great. You will not want to miss that. People spend a lot of money to have him come and give them pep talks. So you got it for free here. And then next Wednesday, we're starting, and we're not even going to think that this is just going to be one lecture. It's going to be a couple, maybe more. But we're going to do day one of kittens, all things kitten. So that'll be Wednesday. Friday, we're still working on a little bit of getting that locked down for next week, but that's what's coming up. So that's it. I am going to stop the recording, and I am excited for Friday and for next week, where it looks like we're going to keep going with this thing. So hope you guys like it. Have a good day, everyone. Bye-bye.